Lynn's my best friend. She was the most selfless, kind, genuine person. As a little girl, she was always happy, always ready for anything. She was spunky, sassy, had a mind of her own. Her first was born. She texted me, she goes, "Mom, I get it. I get why you worry so much about us. I get why you love us so much. Because I have so much love for my baby. And now I get it. I'm a mom. I love being a mom." So it was that next piece. Lindsay gave birth to Nolan. He was healthy. He was strong. She had a seamless delivery. He was delivered on Sunday afternoon, and we got a chance to go see him. Tuesday night, she started with a fever. She ran a temp. The next day, she still didn't feel right. So she had called the doctor, the practice, and said, said how she was feeling. So they gave her an appointment for an end of the day urgent care visit. He looked for inside too, like for anything that might have been left after her delivery. And then he looked at her, he asked Lindsay, he goes, "May I touch your breasts?" And he looked at me and said, "Imagine that. This is the only job that you can actually ask a woman to touch her breasts, and it's okay." So he examined her and everything appeared fine. She had a lot of abdominal pain. He also said too that this is your third child. Sometimes it's harder that way. It's harder, and so he's just trying to kind of give reasons why there was pain. So she did leave a urine sample, and it was the end of the day, and we left. And even when we were at the doctor, she goes, "I'm just afraid to die." And on Wednesday, because she just felt so uncomfortable. So then on Friday, she had called one of the other OBGYNs, and she said that, she goes, "I don't like what that sounds like." So she goes, "Go to the ER." There was strep in her culture, but it wasn't known. Somehow the communication didn't get through. And so when Lindsay went to the ER, they decided that she had been, that she was constipated, that she needed to have a bowel movement. So after we went to the hospital, they had said, take walks, try to be active. So we took a little walk just down the road of where they live, and we turned around to go. It was just a short distance, and she just said, "Mom, I can't. I mean, Lindsay was in incredible shape. She was an athlete. She took care of herself. She took care of her body. She walked. She was active with the kids, and she couldn't even make it, 100 yards. Her legs were achy, so I massaged her legs with lotion, and she said, "Mom, thanks for taking care of me. I'll take care of you when you get older," And so then Monday, I was planning to go over, just help with the kids and hang out with Lindsay and Evan, meanwhile too, Nolan had he was starting to drop some weight because that's another thing, her milk had not come in yet. Then on Monday, the 2nd, Evan called. He goes, "Are you on your way, Jane?" I said, "Yeah, I'm just coming down the road. I left home. I'm on my way." He goes, "Okay, because Lindsay's just not feeling well at all." And so then I get there, and meanwhile, campus security is there. Evan's got the phone in his hand. Sigrid and Finley, they're eating a popsicle or a freeze pop because they're just trying to be occupied. And Lindsay's sitting on the couch and she can barely catch her breath. And she's sitting there and she's just really uncomfortable. And so Evan called the ambulance. And Lindsay's scared. She's scared. And so other doctors were called. I was asked to sit out in the hallway. Doctors are in, out, and I said, how could this even happen? You know, I just one of the doctors who was on call from her, he goes, "Sometimes you're not sick until you're really sick," and that didn't make sense to me. But and then they let me come in so I could see her, because then they were going to bring her up to ICU, and they told her and me that they were going to intubate her, so that would help her breathe. And she said to the doctor, she goes, "I'm afraid I'm going to die. I'm going to die. I'm afraid I'm going to die." And he said, No, you're not going to die. You know, you just." And so that was that was July 2nd on a Monday. And then everything is kind of blurry until Wednesday, the 4th. As far as timing, they took her uterus. They took, trying to save her. They took her intestine, and then they took over and over, and they flushed, I think, tried to clean everything out. We were just sleeping in the waiting room, and we're, friends and family. We'd go see her a little bit here and there, talk to her. Evan would play music for her. He'd show her videos of the kids so she'd hear their voices. He stayed with her and would talk with her. We'd go in and we'd pray with her. And Evan brought pictures that the kids made so that when she woke up, she'd see them. We just had family meetings with Evan and the doctors, and eventually they just said, we can't do anymore. I just remember them, a whole group of them in the hallway talking to us. And I remember I don't even remember who was there, but I know just their faces, and they worked so hard, and they did work hard, and trying to not let this happen. And I just remember a young woman just crying too. She was like an assistant or a PA, or I don't know, but I just remember that we just all just crumbled. We just all just in the hallway there just crumbled, and outside of ICU, and then we had to say goodbye. And that was like, I couldn't even believe that's what we were doing. About maybe a week after Lindsay passed away, because he spiked a temperature, and they said the pediatrician said, "You need to go to the hospital," and especially in lieu of everything that had happened with Lindsay. And so, and he had strep too, and then he had to be in Children's Hospital for 14 days. Another infectious disease doctor had come in, and we're talking to him across the crib, and we were saying something. I think the fact that Lindsay's breast milk hadn't come in yet or something. He goes, "Well, that's a sign of infection," and you kind of go, "Well, then how come the people who should know don't know? Or how come the people that should know didn't do, didn't react, didn't respond, didn't look for what could kill her before they decided that she was constipated? You know, those kind of things, those questions start to bounce around in my head. Like, if you trust, you trust the people who should know, and at least, and you feel like, okay, because I beat myself up. I go, how come I didn't push harder? How come I didn't, she was advocating, how come I didn't say, well, we're going to the hospital right now? How come I don't, I feel like I let her down because and I know it's because you trust to the people who, I know people make mistakes. I know doctors are people, they make mistakes too. I just feel like this was one of those mistakes that shouldn't have happened. They shouldn't have made this mistake. There were, because she spoke loudly. There was the investigation, and I know they communicated about what actually happened, shortly after, when all the autopsy and all the labs came back and all those kind of things. But as far as just even touching base with us as people, as family members of like what was going on kind of behind the scenes, what was going on with Linz, and how what she was telling us, that was and not what you were witnessing, right, and what we saw. You're right, that wasn't communicated in that manner. That personal piece wasn't there early on. It wasn't there early on. I think people sometimes are, are afraid to say things. We entered into mediation, and the first day that we sat, it was a 2-day process, I remember, and I remember sitting at this big table in the lawyer's office, a conference table, and sitting across from, the chief of staff or the president of the hospital, and the head of OBGYN, and the head of nursing, OBGYN nursing, and they were wonderful. I mean, they said, we know this shouldn't have happened. And they were apologetic and sympathetic and empathetic and kind and really wanted to implement protocols and programs, and that so this would never ever happen again. And I know since then things have improved. The head of the OBGYN department was charged with the task of, making sure things would be put into place so what happened to Linz won't happen again. She has a heart for women's health and to prevent things like this, and to educate her staff, and she wants that to grow because she doesn't, and her heart is so so good, and so she's been really great at facilitating a relationship with us. In my head, like intellectually, I know that by putting systems in place, that so that what happened to Lindsay won't ever happen again, doesn't make me feel any better. It doesn't give me peace because we've lost Lindsay. My grandchildren don't have their mother. My son-in-law doesn't have his wife and can't share their lives together and grow old together. And they can't raise their kids together. It's so important that they listen to their patient, not be so sometimes like clinical in the sense that, you know, like patients know their bodies, you know, and they know what's not right, and to really be in, try to be in tune with that human piece of just of their patient, and that their patients, you know, like my daughter wasn't just a patient. My daughter wasn't just a person who went and had a baby. You know, she was a mother. She was a wife. In anybody, I mean, any human. I mean, it's sometimes I think sometimes we're not looked at as people, you know, and humans, and whose life has value. I guess so. I just.